My name is Mr. Nduka Ozo. I'm the project director for Center for HIV/AIDS and STD Research. CHISTA. CHISTA is a grassroots non-governmental organization, not-for-profit, based in Nigeria. We are actually working in the rural communities, but sometimes we overlap at the national when there is need for us to do some activities at the national level. We've been in existence for the past 18 years, and our major area of operation, our target areas are people in the rural communities. Currently, we are working in Bauchi State, Nigeria. We're working in Lagos State, Nigeria. We're working in Imo State, Nigeria. And then we have a liaison office in Abuja, Federal Capital Territory. Let me take up one of the states where we operate and then say something about it. Perhaps you can understand our background more. In Bauchi State, what we do there is active case finding for tuberculosis. And it takes us to the rural areas, the very hard to reach areas. And one thing that is outstanding in this assignment is that you get to meet the people one-on-one. So it's not theoretical, but it's a practical experience. You see, some of the people in these communities cannot access health facilities. The reason is because health facilities are about 30 kilometers from where they stay. And then when it is raining, during the rainy season, everywhere is flooded. You can't even move from your house. So accessing health facility during this period is a very big issue. Even during the dry season, you might not be able to trek to such a far distance because you don't have mobility. You must go by road. Maybe the few ones who have bicycle can ride it on the bicycle and then get there. But before you get there, you can imagine the intensity of the sun, sometimes at 40 degrees centigrade or even more than that. So accessing health facilities is a very big issue. So we decided to do mobile clinic, taking health facilities nearer to them. And that is where we discovered that a lot of climatic issues has hindered these people from accessing health facilities. The environment, the weather, the flooding, the intensity of the sun. Sometimes pregnant women can't even access health services, so they go to the herbal, the traditional birth attendants to get the services they require. Sometimes in a very raw way, unhygienic way. But what can they do? It is better for them than trekking such a very far distance to the city to access health services. Sometimes they will be able to go to the facility and discover that the health centers have closed for the day. And then what do? It's either they sleep over or they come back the next day. So it's a big issue, and we can't allow this to continue. We are so passionate about the situation, and then we decided to carry our health services to the places. Unfortunately, we can't even serve 20% of the population over there because of resources. But going to those communities are lifeline for them. Any day we go carry activities to those places, the number of people we attend to is such overwhelming to us. Because even though some of us are not medical doctors, they call us doctors. But we go with maybe community health workers, and then sometimes we get some doctors fresh from the university to volunteer sometimes to work with us. Now the major problem is that we can't serve more people because we don't have the resources, especially since the fund freeze from the USAID. We don't have money again to buy some basic drugs, test kits and all that to attend to the people in those communities. One thing we can take out from this conference is we are ready to network. We are very, very ready to network to provide more services to these communities. That is what thing we require from participants from this conference. If there are ways you can support the activities we are doing, don't fail to reach out to us. I will display my number. I will call my number for you to reach me, or through the coordinators or the organizers of this conference. I'm looking forward to hearing from those of you that are in this conference. God bless you.